Are you ignoring the subtle signals your body is sending? For many seniors, a heart attack doesn't begin with a dramatic collapse. It often starts with quiet, easily missed warning signs. In today's episode of Elderly Wisdom Chronicles, we're uncovering the 6 silent clues that could save your life, or the life of someone you love. Don't wait until it's too late. Stay with us to learn the life-saving secrets every older adult should know. Because wisdom isn't just about living long, it's about living well. Do you know the 6 subtle signs that could save your life? When most people think about a heart attack, they picture a dramatic scene, someone clutching their chest, gasping for breath, a scene right out of a Hollywood movie. However, in real life, heart attacks often begin much more quietly, especially in older adults. The signs can be sneaky, vague, and easy to dismiss. Understanding these warning signals is crucial because recognizing them early on can truly make the difference between life and death. Not just for yourself, but for your partner, your friends, and your loved ones. Let's take a journey through the body together. We'll uncover the 6 most important signs that your heart may be in trouble. Along the way, you'll find real-life stories and practical advice tailored for seniors, so you know exactly what to watch for and what to do. This is your guide to listening to your body and to living your years with joy, confidence, and peace of mind. 1. Chest pain, the classic alarm bell. Almost everyone should watch. 4. Imagine you're spending a quiet afternoon working on a crossword puzzle or enjoying a phone call with a friend. Suddenly, you notice a strange sensation, perhaps a heaviness or uncomfortable tightness right in the center of your chest. For some, this pressure can feel like a giant stone pressing down. For others, it's a squeezing, aching, or even burning pain. You might describe it as an elephant sitting on your chest, like a clamp tightening, or even a sharp stab. But here's what every senior citizen in America should remember. Chest pain during a heart attack isn't always severe. It can be mild. It can come and go. Some folks ignore it, chalking it up to heartburn, a pulled muscle, or simply getting older. Many women in particular may feel only a vague discomfort, a fleeting pain, or just an odd sense that something isn't right. They may dismiss it as fatigue or stress, rather than a medical emergency. Take, for example, Ed, a 66-year-old retiree from Ohio. One morning after mowing the lawn, he sat down to rest and felt what he described as pressure, like someone was gently pushing on his chest. It lasted only a few minutes before fading away. Ed thought little of it and carried on with his day until the pain came back, much stronger and much scarier. Thankfully, by then, his wife recognized the signs and called 911 immediately. Doctors like Dr. Richard Kovacs with the American Heart Association remind us, if you experience chest pain or discomfort that lasts more than 5 minutes, don't brush it off. Call emergency services right away. It's far better to have a false alarm than to take chances. Time lost is muscle lost when it comes to your heart. It's also vital to understand that for seniors, especially those with diabetes, heart attack symptoms can be even more subtle. Some people hardly experience any chest discomfort at all. Take note of any new, unusual pain, tightness, or strange sensation in your chest that you can't explain, and seek help quickly if it happens. 2. Shortness of breath. Sometimes it's not just getting older. Breathing is something we all take for granted until, suddenly, it's a struggle. Shortness of breath, especially when it comes out of the blue or hits you while you're resting, is a classic warning sign of a heart problem. As we age, it may be tempting to attribute a little breathlessness to lack of exercise, weight gain, or ordinary aging. But here's the surprise. Heart attacks can trigger shortness of breath even if you're sitting quietly reading a book or watching TV. Picture this. Ruth, age 71, enjoyed walking her golden retriever around the block every morning. Lately, she noticed she was getting winded just halfway through her usual route. One particular day, she had to stop twice to catch her breath. Ruth told herself it was just a bad day, perhaps the humidity, but her shortness of breath seemed to get worse over the week. She was relieved when her daughter insisted she visit her doctor. Tests quickly revealed a dangerous decrease in her heart's ability to pump blood. Her breathlessness wasn't just fatigue. It was her heart calling for help. Heart-related shortness of breath can be dull or severe. It may develop slowly over days or hit you suddenly. Sometimes it feels as if you can't get enough air, no matter how deeply you try to inhale. For some, it's paired with chest tightness, dizziness, or a feeling of anxiety, almost like having a panic attack, but with no clear trigger. Dr. Nika Goldberg, a prominent cardiologist, emphasizes that for women and elderly patients, shortness of breath may be their only sign of heart trouble, no chest pain at all. She often tells her patients, if you ever find yourself out of breath doing an activity that never bothered you before, especially if you're not sick with a cold, don't wait. Get checked out right away. While it's true that many seniors live with chronic conditions like asthma or COPD, it's still wise to notice any change in your breathing pattern. Sudden, persistent, or worsening breathlessness deserves medical attention. It's better to express too much concern than to ignore a signal your body is clearly sending. 3. Pain radiating to the arm or elsewhere. The unexpected heart attack. Clue: if you've heard that heart attacks can cause pain in the left arm, you know part of the story. But did you know this pain doesn't always begin in the chest or even stay there? Heart attack pain can travel anywhere, to the shoulders, neck, jaw, back, and either arm. Sometimes the pain skips the chest altogether, especially in older women. Imagine Dave, age 73, a lifelong bowler. During a league night, he suddenly felt an odd tingling and heaviness down his left arm. It wasn't agonizing, but it was distracting enough that he sat out the next round. He massaged his arm, thinking it was strained from carrying the groceries that afternoon. It never occurred to him, or his friends, that his discomfort could be heart-related. Dr. Atul Gawande, surgeon and author, explains, some seniors don't realize that pain or numbness in the arm, jaw, or even upper back, especially when unexplained and accompanied by a sense of unease, can be the heart sounding an alarm. How might you describe this kind of pain? Some people call it an electric pain. Others say it's numbness, tingling, or pressure. It could be a dull ache, a heavy feeling, or even an odd pins and needles sensation. It almost always starts unexpectedly, not because you slept wrong or threw your shoulder out. If the pain lingers for more than a few minutes or comes with other symptoms like sweating, weakness, trouble breathing, or a feeling of doom, don't hesitate. One important tip for seniors: don't convince yourself it's just arthritis or old age. The older we get, the more likely we are to have aches and pains. But a new, strange, or intensifying discomfort anywhere in your upper body deserves a closer look, especially if you're aware of your heart disease risk factors. 4. Nausea, indigestion, and stomach upset when it's more than a bad meal. Next time you feel a bit queasy or deal with indigestion, pause and ask yourself, could this be something more? Older adults, especially women, can experience gastrointestinal symptoms as their main warning sign for a heart attack. This includes nausea, persistent indigestion, stomach pain, bloating, or even vomiting and diarrhea. Consider Marie, age 75, spending a peaceful morning in her garden. Suddenly, she felt queasy and had mild abdominal cramps. She assumed it was something she ate at dinner the night before, so she sipped ginger tea and went on with her chores. Within an hour, the nausea was joined by a cold sweat and a slight sense of weakness in her arms. At her granddaughter's insistence, Marie called her primary care doctor, who advised her to go straight to the ER, a decision that very likely saved her life. Dr. Susan Shurin of Mayo Clinic points out, heart attacks don't always announce themselves with chest pain. Sometimes the only clue is an upset stomach, especially in elderly women. Stomach symptoms due to a heart attack usually don't improve with antacids, rest, hydration, or eating lighter. In some cases, vomiting and diarrhea appear out of nowhere. What should you pay attention to? Nausea or stomach discomfort paired with any other strange symptoms, like chest tightness, lightheadedness, or cold sweats, should never be ignored. If you have risk factors such as diabetes, high blood pressure, high cholesterol, or a history of heart disease, it's doubly important to pay attention to new stomach problems. A handy tip: if you're feeling off and you can't think of a good reason, trust your instincts. Don't wait to see if it will go away. Let your doctor or a medical professional know what you're experiencing. Thank you for joining us on Elderly Wisdom Chronicles. Remember, your greatest strength at any age is the wisdom to listen to your body and act when something doesn't feel right. If you found this information helpful, please like, subscribe, and share this video. Your support helps our community stay informed and empowered. If you or someone you love has experienced any of these warning signs, don't hesitate to talk to your doctor or seek help immediately. Stay tuned for more tips and stories designed to help you live your golden years with confidence, health, and peace of mind.